Hey everyone, welcome to my channel. Today's focus is ankle injury. Today we have a client who is none other than my son, who is 15 years old, who has sustained an ankle injury while playing soccer, and that's his right ankle, as you can see here. Now, this is a real patient, so today I'm going to demonstrate a few techniques, what you need to know for the early stages of ankle rehab. Now, most of you know already that any acute injury, they have to go through three phases. You got the inflammation phase, you have the repair phase, and you also have the remodeling phase, which is the last phase. Now, today's video is only going to focus on the very first phase, which is the inflammation phase, also known as the protection phase. It's crucial to, take, good care of the injured area. There are some techniques you need to do so that it sets the pace for the repair to start early and of course remodel so that the person can go back to activities as fast as they can. Okay. Now, before I go any further, this is something I want to show you. Now, I want you to remember a simple acronym. Now, traditionally with injuries, they always use the acronym RICE, which is RICE. So as physios, we take up like two more extra steps into RICE, into the inflammation phase, where we use, instead of RICE, we use PRICEM. So when I say PRICEM, I mean PRICEM. I want to show you a sheet here. Bring it nice and close. So you can actually see this phase we're going to talk today is the inflammation phase, also known as a protection phase. It's very obvious that this phase is all about protecting, not really talking about exercises or getting any major movements or strengthening or getting back. It's all about protecting so that repair can begin early. So now, as you can see here, so here's the acronym. Instead of RICE, we use PRICEM. So the P stands for protection, the R is rest, the I stands for icing, the C is compression, the E refers to elevation, and the M refers to modalities. So let's really talk about what are these different phases of the protection phase and what these PRICEM really mean. Okay, let's talk about the first part of the PRICEM, which is protection. Now, protection means just protecting the area. Like if there was a fracture, it's obviously the protection is you have to go for a casting. They'll put a cast, and for about like 4 to 6 weeks, pretty much movement can be restricted depending on which bone is affected. Now, in a case like an ankle injury like this, protection means protecting the segment. Now, this is day 3 after injury. Now, I'm just going to bring this as close as possible. Now you can see here. You do see a little bit of a swelling here, but the day when this injury happened, this area was the size of a tennis ball. Now you can imagine day 3, swelling is reduced, about 90% is down, and today's day 3, my son is able to take more weight, and he was even telling me that he was able to walk around without the crutches. So which is good news. That shows that the first 2 days is going to be quite crucial. Okay, so protecting here means able to put a splint. Most of you heard of a rigid splint. A splint is where there'll be 2 metal brackets on the sides. You sleeve it in so it prevents any medial lateral movement of the ankle. So that's a protection. Or in my case today, I'm going to demonstrate an important technique called taping technique. Now, as you can see here, so this is a rigid tape I use. It's a company called Leukotape, and this is the skin tape which goes on that. Now, this offers the protection for the ankle in the initial phases. This is crucial. My son had this right from day 1. I put this on. Like today's day 3, I removed it just to demonstrate, to put a tape in. This is good for like 2 days. You can keep it on, can get wet, nothing happens, everything goes fine. So this is protection for an injured segment like ankle. I'm going to show you how to do a taping today. Okay, so before we do the taping, let's talk about like the mode of injury, how this happened. So what my son sustained is a grade 2 lateral ankle ligament injury. So we were able to take some x-rays, we took him to ER, we ruled out any fracture. We also took a look at the growth plate here. Keep in mind, he's 15 years old. So in this case, we need to take a look at any injury which can affect the growth plate as well. So everything has been ruled out, everything good. Now we know that this is a lateral ligament injury. Today, I'm not going to talk about any testing, but rather go straight into protection. Okay. Now, before you do any rigid taping, now remember you need 2 tape. Now this is the sticky part of the tape, this does not go on the skin. Keep in mind. So this is about 1.5 inches in width, and this tape is about 2 inches. So quite obvious that this goes on the skin and this tape goes on this tape. That's why this one is a little broader and this one is a little narrow, right? So don't put this rigid tape on the skin because it gets very sticky to take it off, okay? So always use the skin tape which goes on, which I'm going to demonstrate, okay? Now to do this, what I'm going to do is I'm going to choose the area just above the malleolar region. So that's a lateral malleolus, and this side you have the medial malleolus. So I'm going to put my first tape right on top. Now this is to anchor the tape at the bottom too, okay? So what I'm going to do is I'm going to do a quick measurement. So I'm just going to go around and see how much tape I need and circle around and I measure and just come back and just do it. Now you definitely need scissors to cut this because it's kind of a cloth material. You can't rip it to tear. If you feel it's going to fold while you're doing it, just make sure that you're able to roll it the other way to the opposite side. So now you know that it's nice and straight, okay? So all I'm going to do is, usually tapes, when you try to peel it off in the middle, it comes off. You can see here. And I'm going to do the other side too. There we go. Let's move this to the side so you can see what am I doing. So all I'm going to do is I'm going to put this skin tape right above the malleolar region. Oh, sorry about that. Let me go this way. It's a bit sticky. All right, there we go. So I'm just going to put it right above the malleolar region. You can see here. So that's my first tape. That's the skin tape. I'm still not put the rigid tape yet. Okay. Now, the next, what I'm going to do is I'm going to measure, watch carefully. I'm going to go from this end of the lateral malleolus below the foot, and I'm going to go around to the medial malleolus. I'm going to measure how much I need for that. I'm going to go ahead and you can see I'm going to do a quick cut. All right. You can see here I'm going to go this way like a loop. One end to the other, right at the bottom of the feet, right? Once again, I'm not pulling the ankle to any position right now because this is just the skin tape. Just going to take it off. Just going to move it a little further down so you can see what's happening. Okay, there we go. All right. All right, I'm just going to go start from the medial malleolus. And just make sure that the client is slightly dorsiflex the ankle to the level of pain. And then I'm going to loop all the way around. And I'm going to bring it to the lateral malleolar above and goes all the way up to this region over there too. Okay, so you can see here, all the way down. So that's my skin tape, which goes on the top. All right, all set. Okay, here comes the important part. Now comes the rigid tape. Okay, so this tape is going to go on this tape, so it's easier to remove it. Okay, now keep in mind that you have to understand how this injury happened. So the injury happened in a way that I'm going to probably show this on this foot. So it was more of a plantar flexion and inversion and adduction. So combination of this would affect the lateral ligaments. So when you're taping, remember you have to do the opposite of dorsiflexion, eversion, and then a little bit of an abduction, which is like getting the foot to a neutral position. So that's the opposite of the injury, which I'm going to do the same thing for this foot as well. Okay, let me show you how to do that. Okay, now let's take this off. You're most welcome to use a scissor if you want to. This is a sticky one, you can see here. Now, what I'm going to do is I'm going to measure this. Now, I'm going to measure for the loop first. So I'm going to go at the bottom, the non-sticky part over here. I'm just going to loop around to see how much I need, how much length I need. I'm going to go a little more. You don't want to do too much. You don't want this to go on the skin because it gets very sticky. Now you can see here, I'm not using any scissors, but if you hold the edge, they go really quick. You can tear it off. Try it. You might be able to get it. Okay, now here comes the important portion. Now I'm going to go, I'm not going to go inversion. If possible, to a pain tolerance, you're going to ask the client to dorsiflex a little bit above and then slightly out. Make sure it's kind of like angled out. And I'm going to bring this over here so you can see what's happening. Okay, right here. So I'm going to put this tape right there. I'm going to start from here. As you can see here. Now just make sure that keep your hand, make sure that sometimes the client will just bring it slowly down to a plantar flexion position. So this is where you got to pull the tape nice and taut and tight. See how tight I'm pulling it? And then I'm going to take it all the way to the other side. And you can see here, all the way here, the bottom to the side. Now the client would feel the little bit of taut tightness already. Okay, now what I'm going to do, I'm going to anchor this tape around with another one. I'm going to tie it off. And you can see here, so I'm going to go from here. I'm going to go around. All right, you can see here, I anchored another one piece here so that this tape doesn't come off. Now, you can see that this taping is how we're going to get the protection. So this tape does not allow the foot to invert and cause any stress on the lateral ligaments. This is crucial when it comes to the inflammation phase where I talked about protection. Okay, so the protection is done. We have done the taping. Now it's recommended the client, depending on the type of injury, the client can use crutches to walk. They can avoid sports activities, avoid climbing steps too much as possible. Just reduce the amount of weight they're going to take on the ankle, right? So that's the prism, the protection part. Now then comes rest. Rest is obviously we talked about, like avoiding activities and stuff. It's very obvious. And I is icing. Icing is crucial. Now, you can use any traditional ice pack. Always remember not to put the ice directly on the skin, but rather just make sure there's some sort of a protection that the ice pack doesn't touch on the skin. Icing needs to be done like for 15 minutes, but make sure at least it's done every hour, possibly at least once every 2 hours. Icing is done for many reasons. One, it does reduce the inflammation. It reduces swelling. You can imagine this place was swollen like a tennis ball, but today there's absolutely nothing. The icing worked. It really helped. So make sure to do the icing. Now, when you put the ice pack, just don't keep it. What I did is I put the ice pack, then I used a tensor bandage to kind of keep it nice and tight. And then what I did is I put a few pillows to keep the leg up, which is the E part, which is elevation. So we talked about protection, which is P, and we talked about rest, which is R. The I is icing, and then comes compression, which is, of course, talk about the bandaging too. Okay. Now the E is elevation. Elevation is getting that leg above with pillow so that you're helping for any extra fluids to probably drainage back. You're increasing the lymphatic drainage so that you don't have too much of swelling. Now, keep in mind, too much of swelling in the area will cause irritation due to all the chemicals. It's going to increase the pain. When you do the icing also helps to reduce the pain by the pain gate blocking system. It blocks out the pain, makes the place numb. It really helps with the pain methods as well. Now, also remember, when you're doing any icing, just keep an eye on those toes. You don't want any discoloration or bluish discoloration, which indicates that maybe there's too much of icing too. So that's why it's good to give at least minimum 1 hour spacing between the icing. Okay. So we talked about elevation, the importance of that. The last one is modalities. Now, what are modalities? Modalities are, as physios, we use certain electrical techniques to help with healing and reduction of pain. I'm going to show you a few modalities I have here. So you can take a look at that and see some of these which can be achieved in a clinic. If you have a physio, you can most welcome. You can, take advantage of some of these treatments, which helps to accelerate the healing. All right, here you're looking at a few modalities. The one I have over here is called the ultrasound. So this is a therapeutic ultrasound where we use on clients for healing purposes. I'm not going into the details of how to do an ultrasound in this video, but this is just to show you the M part of the prism refers to modalities. On this side, I got a TENS unit. A TENS unit is just for pain reduction. It's an electrotherapeutic technique. It helps to block the gate so that it reduces pain. As physios, we don't believe in using any medication for pain relief. We would rather use these modalities for pain relief and ultrasound for healing. Now, ultrasound is known to increase fibroblastic level, to just to reform those broken collagen. So all the tissues and any soft tissue which can heal well when those fibroblasts arrive. So these are what we use as modalities when it comes to the inflammation phase. All right, now taping is done. Now the C part is what we call compression. I'm going to use a tensor bandage. I already did a video on how to do a figure 8 compression bandage. So this really helps to reduce any swelling around the area. So imagine you got the taping and you're going to do the tensor bandaging too. I know this bandage has gone pretty old. I think it's time to replace it, but just for learning purposes, I'm going to use it again. Now, once again, it's important. Now, the injury was due to inversion. So when I'm bandaging, I have to go the opposite direction towards the eversion direction. So I'm going to go this way, not this way. If I go this way, I don't want to be pushing the ankle towards inversion. It should be the opposite of injury. Make sure to check the bandage. If you have the curvy end and there's a soft end, make sure that the soft end touches the skin, so you don't want any creases. So there we go. I'm going to start from the end. I'm going to do 2 overlapping wraps. Okay, I'm going to go up. I'm going to make my 8. Please check my other video for this. I'm going to do this really quick here to complete the compression. So you can see the figure 8s. You can see those angles. There we go. Now I'm just having a little bit of attention, not too tight, not too slack. There we go. I'm just going to go over here. If you have a tape, you can tape it around. I'm just going to insert it for now. Okay, always remember, after you do the bandaging, check the circulation levels, pinch and release to make sure that it turns nice and pink and just from pale to pink. If it just stays pale, that means maybe it's too tight. May have to remove that too. So this is the compression portion for the prism. Okay. All right. Here's a quick recap. So this is the plan for the inflammation and protection phase. We talked about protection by using splints or cast or even using rigid taping. We talked about rest, avoiding any activities which can aggravate the problem or make the injury worse. Icing to reduce swelling, to reduce pain. Compression, we talked about how to use the tensor bandage to reduce swelling. We talked about the importance of elevation. Once again, it's to bring in any swelling back and increasing the lymphatic drainage. And we talked about a few modalities like using ultrasound, using transcutaneous electrical nerve stimulation units, or even using interferential therapy. Any of that will apply for the modalities too. So hopefully this video helps you to understand the importance of inflammation phase and how it can help to heal faster when it comes to any acute injuries. Okay, good luck.